Okay, this is Dr. Mitchell again, and the ergogenic aid we're going to talk about now are blood buffers. Now, already just by hearing that term, you should already have an idea what we're talking about here. So when we're talking about blood buffers, we're talking about compounds that is going to buffer pH in the blood. And we've talked extensively about how important that is in regards to clearing hydrogen ions, how that affects muscle cell function. We've talked about how numerous systems, how pulmonary function, our lungs, our kidneys work to assist with that as well. And so already you should have some idea of what a blood buffer would be, something that would buffer those hydrogen ions. And so oftentimes when we're talking about blood buffers, we're talking about sodium bicarbonate, or what you know as baking soda. And not surprisingly, we know that acidosis occurs during exercise. We've talked about that extensively. And it's not just acidosis due to lactate. There are numerous other acids that are produced during activity that lead to this drop in pH. And this drop in pH causes numerous issues in affecting various enzymes in glycolysis and the Krebs cycle, causing issues inside the muscle cell with receptivity of calcium, affecting cross bridges with actin and myosin. And so not surprisingly, being able to control pH is pretty important. And we've talked about that before. The idea here is that if you can supplement, or if there's a way you can ingest or take in buffer, or something that would buffer that drop in pH that would keep pH normal, you would not have those consequences. And therefore then exercise activity would not be hampered, and in theory you could improve performance. And that's kind of the idea with sodium bicarbonate and various blood buffers. Now, the way this looks, and this can look a lot of different ways. A common way would just be to ingest some amount of buffer prior to activity. And there are varying dosages and varying studies. I will tell you, there's even research now out where there's actually some decent data with topical ointments. Like literally they have the bicarbonate in a cream. You put it, it goes through transdermally, and there's actually good evidence to show it works. So there are ways to do this. And I'll tell you, the evidence is pretty good that at the very least it can drop pH. Now, the issue with blood buffers is one, the stomach's in the way. And that's one of the biggest issues with blood buffers, is that because the pH in the stomach is so low, much of that buffer gets, we'll just use a better term, neutralized in the stomach. And the second bad part of that relates to what happens when that occurs. So if you're familiar again with the reaction of when we are buffering hydrogen ions, a byproduct of that is CO2. Well, you know, when that's occurring in our body and we breathe out that CO2, that's not a big deal. But when it occurs in the stomach, that CO2's got to go somewhere. And not surprisingly, that has to travel through the small intestine, which can cause GI distress, irritability. And one of the big side effects we see with the use of buffers is just that. We see this GI distress in some individuals. It can be quite severe. So there's definitely side effects to this, and what you see in the literature is a lot of documentation that there are definitely limits to this, and it definitely takes away from some of the performance benefit. But it is definitely something that can be done. I will tell you, baking soda is not the tastiest thing in the world. Put it on something that's a little more edible, maybe it is. But there are definitely ways to make this a little bit more ingestible. But the data is very good that, yeah, this definitely can keep pH in check during activity, particularly during activity where we're going to see challenges to pH. So we're really talking longer lasting activity. And yes, we can see obviously pH drop very quickly, but it's often in the activity it's going to last longer. That's going to be near or above the lactate threshold. We're really going to see the longer, more term effects of pH drops. It's really those activities that we seem to see this help the most. A lot of the studies actually we see are in cyclists, not the only group, but for various reasons, just because of nature activity and a lot more muscle mass, particularly in the quadriceps. We can really see this seem to work really well. But definitely another ergogenic aid to to know, to consider, and we will see you in the next video.